Hi, it's your friend Christine here. So I've been promising you that I would talk you through some of these canal treatments for vertigo that are a bit challenging on your own from the other videos that seem a little longer. So, excuse me, with this particular video, it's to treat the right posterior canal chronic issue. So I assume you will have your pillows ready, one at either side of either the bed, your couch, or your floor, and your percussion vibration tool handy. So once you're ready, you're going to sit in the middle of these two pillows. You're going to turn your head 45 degrees to your left and go ahead and head back to that posterior canal. 1, 2, 3. I'm going to time you now. While you're here, the key for this is to keep the head position in 45 degrees of an angle towards your left. Chin is a little tucked down. I've noticed with a lot of my patients or clients, they'll change their head position on the way over to the other side. So this is for the people I've worked with. And so when you're done with the 2 minutes on this right posterior mastoid, when you transition over to the other side, you just bring your legs down, your body up, but your head does not move. Even if you have to hold it there, hold it so it won't extend or turn. I'll give you a countdown, 5 seconds warning once the 2 minutes is done. So you can transition your body over to the other side. The goal for the position on the other side is your eye, left side, will be in the pillow. Your right eye will look at the floor. And then that way you can actually breathe while you're face down. So kind of think about how you're going to get there. Still timing for you. There's our 10 seconds. 5, 4, 3, 2, 1. Transition over to your left, forward facing down. So now you're facing down, right eye looking to the floor, left eye in your pillow. Have your vibration tool in your hand and put it behind your right posterior mastoid. And I'm going to time you for 2 minutes. Ready, go. So while you're face down, just make sure you do not rotate your head upwards. You keep it down towards the floor. Some people will try to turn their head here and wiggle a little bit. So make sure you're fully rotated, looking at the floor with your right eye. Just really turn that head. We're 2 minutes doing this vibration to shake the crystals loose from the posterior canal that are stuck. This is a maintenance. This isn't a one and done treatment. This is something you'll need to do every day, every other day, every few days. You'll know when to do it when you lose your balance to your right heel, during your balance check. Maybe you have pain in your posterior side of your neck, your trap, your levator scapulae, perhaps your lower back on the right. Maybe you have posterior pain down your leg. It kind of reflects that. It's an interesting connection to make. once I time you that your percussion or vibration's done, you're going to stay in this position 3 more minutes. So don't wiggle when you take away that vibration. So you have your 10 seconds to start getting ready to stop the vibration. 5, 4, 3, 2, 1. Now you're going to stay here 3 more minutes. I'm going to time you now. During this last 3 minutes, we're waiting for those crystals to move all the way back in to the house they should live in. Maybe you feel a change in your body. Maybe you're breathing easier, feeling more relaxed. Just remember, keep the head looking at the floor in that rotation, 45 degrees of the neck. So one of the things I encourage is before and after you do this treatment, you check your balance and see if there's a difference. Do you feel more solid in the middle? Or are you still tipping over to your right posterior side? Some people I've met, their neck is so stiff, it's hard to rotate and stay there. Their neck starts hurting. So I've suggested having some moist heat before they do it, and then maybe during, and then that rotation's easier. Because if you can't turn your head enough, it might not be fully sufficient. Some of them might be hanging out loose still. That's something to be aware of. So we're at our 1 minute mark. You have 1 more minute to go. So it's best once you're done with this, just to sit up nice and easy and just look straight ahead. Try not to do something for about a minute or two. See how you feel. Then check your balance again afterwards. So a lot of times I prepare you for the next position so you can think about it. We're still face down right here. Ten seconds. And 5, 4, 3, 2, 1. So just come on up. Sit upright. Just keep your head neutral. Minute or two. And then stand cautiously and check the balance to see if your head was turned enough, if all the crystals went back in. If your balance hasn't changed whatsoever, let me know. Because there's other things going on. And I'm trying to get all the videos for all these things. It's just, I need to find the time. So today I'm doing 2 posteriors. So that's minute overall, minute 9 on the video. I anticipated 8. So I'm going to go ahead and end this one and do the left next. Take care. See you in session. Bye. Oh, and on a side note, if you find somebody that you know could benefit from this and you want to share it to them, go ahead. It's just they need to know the information and talk to their provider or their therapist to see if they have it. Generally, you won't hurt yourself doing this treatment. It's just you want to know what you're doing, because there is a different way to do the posterior one that isn't chronic. And so these videos I'm doing are meant for chronic vertigo. Okay. And hit the thumbs up. Then it will be available to see easier. All right. Take care.